Hello, I am Dr. Lorance Peter, consultant gastroenterologist and director of Department of Gastroenterology and Hepatology at Sakra World Hospital, Bangalore. So what are the two types of inflammatory bowel disease? One is the ulcerative colitis, where predominantly the disease involves the lining of the colon or the large intestine, and it is restricted to the colon. It involves only the colon, and it causes the first lining or the mucosa of the colon to ulcerate and leading to diarrhea or loose stools with blood. So this is one type. The other type is Crohn's disease, where it affects any part of the intestine and from the mouth to the rectum, but predominantly the small bowel and large bowel, and it causes ulceration, stricturing or narrowing, fistulation and obstruction. This is more aggressive disease and it causes more damage. But both have a common kind of a pathway of regeneration. How do you diagnose? Patients with these symptoms should undergo endoscopy or a colonoscopy to look at the intestines and biopsies of any ulcers, and also other tests like stool test, blood test, and imaging like CT scan helps us to diagnose. But the diagnosis is usually done by a biopsy of these ulcerating or inflamed area of the intestines. And how do patients present? They can present, if it's ulcerative colitis, they present with loose stools and blood and weight loss, which is there for some time, 2-3 months, 5 months, 6 months, like that. And some patients with Crohn's disease can have intermittent pain, obstruction, vomiting, which we may pass it on as gastritis, but it may not be, and it can be a Crohn's disease, and weight loss. So and predominantly affects the younger people. And how do we treat? The treatment is generally, anti-inflammatory medications for the intestine, which are topically used. It can involve steroids treatment to reduce the inflammation for a short period of time, but predominantly it focuses on immunomodulators or immunosuppressants like azathioprine and biologicals, which will block the inflammatory pathway. So if medications are used appropriately in appropriate doses and route, and scaling up of the medications based on demand and how the patient responds to this treatment and what is the clinical response, then they can have a good outcome. What are the complications? You can have toxic megacolon or severe bleeding and malnutrition, and sometimes intestinal perforations, obstruction, fistulas. And sometimes patients may require life-saving surgeries like removal of their colon when the large intestine is very severely damaged, or some part of an intestine when it is obstructed because of Crohn's disease. But overall, this disease can be managed very well if it is with adequate medications, good nutrition, and proper follow-up.